Hi, my name's Mick and I'm an Aboriginal Health Programs Officer. I went to Newcombe Secondary College and I guess I had a lot of disagreements with some teachers about certain things. Obviously a little bit rebellious being a teenager, so I didn't know at that time that I wanted to be a health worker or work in the health industry. When I left high school I sort of bummed around and did nothing for a little while, maybe about 6-7 months. And then I got a labouring job. I worked as a labourer for a number of years until I had a bit of a meltdown or a nervous breakdown, and I realised that I needed some help. The reason I got into doing what I'm doing is because there were very, very few Aboriginal males in this role, in this social welfare type role. It made me realise that I have a higher purpose than just, working in a factory or, laying bricks or something like that. And I at the Wildorong Aboriginal Cooperative. I'm an Aboriginal men's health worker. I'm in charge of taking care of and orchestrating men's health care needs, directive from the nurses and the GPs at the health service. So if a client comes in, they're given a health assessment, which is usually done by myself. After they've done that, they finish their chronic disease management plan or just their general health management plan through a doctor. And then at the end of that, they see a nurse, and then from that transition, I am then their main care provider, orchestrating what specialist or what allied health specialist they need to see. So I'm advocating on behalf of the client to get the best possible outcome for their health needs. Some of the things I really like about being the men's health worker is I get to be a voice for the community as a member of the community. Obviously a lot of the time clients or patients don't really understand a lot of the lingo and the jargon that general practices are going to use or health professionals are going to use, so I get to be there and sort of explain it to them in terms they can understand. The payoff for me working with the community, it makes me feel like I'm making a difference. So it's not about the money, it's not about the accolade, it's more about the fact that I get to see my community and my family members being healthy. Geelong is quite a big place. It's not as small as some people sort of make out. The advantages for working within the Indigenous community for Geelong, a lot of the people or a lot of the Indigenous community know each other very well. The advantage of that is if I need to see someone that I aren't or haven't been able to get a hold of, I can ask someone and they know where they are and they can point me in the right direction. Also, when I'm dealing with some of the GPs trying to sign up to the PIP or the Closing the Gap scheme, I can sort of stress the point that I have been a client and I think it's important that you sign up to this because it's going to benefit the Indigenous population of your region. The advantage of having a certificate in primary health care is that I can work in Aboriginal health anywhere in Australia. It's given me a huge step up into stepping into the role at Bowen Medicare Local as the Aboriginal Health Program Officer. So in my current role, I work at educating the GPs by providing them cultural awareness training through Bowen Medicare Local, delivered at Wildorong, which basically gives them an idea of the significance of why they should sign up to the Closing the Gap scheme and deliver Aboriginal health incentives to their particular part of the region. In the future, hopefully, I can sort of step into some sort of policy writing for the government for Indigenous health to make the actual decisions on how health is delivered to the community from being someone that has worked on the front line. I believe the advantage of having more Aboriginal males in the community that are in these particular types of roles gives some of the youth a lot more male role models to look up to and see that you don't have to sit around and drink and smoke because you've got an issue, and everyone's entitled to being given a second chance. If someone's had an issue that's affected them, why not give them a chance at being able to give back to the community? The advice I would give someone that is interested in working within the Aboriginal health industry is to actively seek out how it works. Let them know you're keen to want to be a health worker or a nurse, and they can point you in the right direction. It's what I did. I came to the Aboriginal Health Service 6 years ago and said I want to work in this industry, and 4 or 5 years later I'm working as the Aboriginal Health Programs Officer, so definitely make it aware that you're keen to work in that industry, and everyone's more than happy to help out and point you in the right direction.